Hi, I'm Gary White for Channel 6, Central Kentucky Television. I'm here with Dr. Trish Ciccone at Central Kentucky Optometric Associates with offices in both Lebanon and Springfield. And this month we're going to talk about glaucoma.
Awesome.
So tell us, what is glaucoma?
Glaucoma is a condition where an individual experiences a structural change or atrophy of their optic nerve that coincides with functional vision loss in their visual field.
And what causes somebody to develop glaucoma?
That's a good question. We used to think it was elevated pressure alone, and so we thought that everyone who had glaucoma had to have an elevated pressure in their eye. But now we think it has more to do with, and high pressures can still cause glaucoma, so don't get that wrong, but we think it has more to do with the relationship between the ratio of the pressure in the eye and what we call the ocular profusion pressure. And so you can actually have pressures that fall between what we call normal ranges, or what we call normal tension glaucoma, and still have atrophy or structural change in your optic nerve that leads to loss in the visual field with normal pressures. So it's not just pressure alone anymore. High pressure can be a contributing factor or a causative factor of glaucoma, but also things like low blood pressure or hypoperfusion of the optic nerve. If someone takes their blood pressure medicine at nighttime, it may cause their blood pressure to go way down, and that can contribute to low tension or normal tension glaucoma. People who have sleep apnea can have low perfusion pressures, and they can develop low tension or normal tension glaucoma. Folks who have poor vascular supply, atherosclerosis or hardening of the arteries, and diabetics who are not in good control also are prone to developing low tension glaucoma. So traditionally we think of glaucoma as a pressure disease, it's not really just the pressure anymore.
When we talk about pressure in the eye, what exactly does that mean? What's the pressure that
Think of your eye like a tire or a balloon, and the fluid inside the eye exerts a pressure on the tissue, very much like the air exerts a pressure on a tire. And if the pressure is too high, it can cause the blood vessels to be kind of closed off, or it can cause even mechanical pressure on the neurons of the optic nerve and the neural pathway also. So it can be from reduction in vascular supply as well as just pure mechanical pressure, traumatic damage from the pressure being too high on the tissues. Mm-hmm.
Now, are there more people who are likely to develop glaucoma?
A certain segment of the population, and there are people that are more at risk. If you have a family history of glaucoma, that puts you more at risk. If you have high blood pressure, sleep apnea, diabetes, that puts you more at risk. If you're nearsighted or myopic, that increases your risk. There's different types of glaucoma. There's glaucoma, what we call primary open-angle glaucoma. There are secondary glaucomas that can occur from other types of conditions like pigment dispersion or pseudoexfoliation. There are glaucomas that can be caused by certain medications. And then there's narrow angle or angle closure glaucoma. Probably the most dangerous thing about glaucoma is that in most cases there is not a lot of pain or discomfort associated with it. So there's not a warning sign to say, hey, something's wrong, go get to the doctor. And the change in the vision and the loss of the vision is slow and incipient over time that it's occurring, and nobody even knows that it's occurring. So it's important for everybody to get regular screenings to, one, measure their pressure, but remember we said it's not just pressure alone. We have to look at the optic nerve. We also have to, and those people who are suspicious, we'll scan their optic nerve with this OCT machine right here, and we'll do a visual field test, which is in the room next door. And so it's not just one factor. You have to look at the pressure, the appearance of the nerve, the results of the OCT, and the results of the visual field to really determine whether someone is experiencing glaucomatous nerve loss.
So there aren't many exact symptoms for the people at home to be saying, oh, I may have glaucoma.
Yeah, for the majority of people, there's not, and that's why it's so dangerous. For people who are experiencing really high pressures and experiencing angle closure or acute type glaucomas, sometimes their vision will get steamy, their pupil won't work right, or it'll be kind of mid-dilated. And there are, in those situations, there are some signs or symptoms that something's going on. But for the most common types of glaucoma, the primary open angle and the primary low tension or normal tension glaucoma, there is no pain, no discomfort, nothing to warn you that something's going on. And the change occurs so incipient and slow over time that you don't even realize that it's going on. And once you lose that vision, and once those nerve fibers are damaged or deceased, you can't get it back. We can try and prevent loss from glaucoma and stop loss from glaucoma, but vision that is lost, we can't get back. And so everybody needs to be screened on a regular basis.
So that's what I was going to ask you, if there is treatment for it. There's preventive, I guess.
The most important thing is diagnosing and getting the appointment and coming in and getting the evaluations to determine if you're a suspect or if you do in fact show indications that you do have glaucomatous loss or damage. We'll start out, in a lot of cases, we might start out with drops or we might start out with laser. In Europe, they start out with laser before they use drops, so they approach it a little differently than we do in the United States. But the SLT is a great procedure for younger folks who have high pressures or who are showing development or progression into glaucoma that don't want to spend the next 40 or 50 years putting drops in their eyes. So sometimes with them, we'll even start with, do what they do in Europe and start with the laser as opposed to the drops. But you can start with drops to control or lower the pressure, or do laser to lower the pressure. If that's not effective, you can flip-flop and do the laser next or do the drop next. For folks who have advanced glaucoma or glaucoma that's advancing despite lowering the pressure or despite using the drops, or who can't use the drops for whatever reason, then we might put some little filters in. There's these little filters called MIGs that get put in during your cataract surgery. We also have these little shunt, little tubes, that little shunts, they're like little straws that you can get implanted in your eye to help drain the fluid out of your eye. So there are some surgical techniques and procedures that can do that. So the treatment, the only treatment we really have addresses the pressure, even though we say that not all glaucoma is caused by high pressure. We still, that's where our treatment stands, and that's kind of an oxymoron there. Yeah. It's a little confusing for some people, but they are looking at other things about balancing ocular perfusion pressure, things like if you take blood pressure medicine, and again, don't do this on your own, always consult with your physician. Might it be better to take it in the morning as opposed to in the evening? And for folks who have undiagnosed sleep apnea, that's big. Eye doctors are recommending more and more sleep studies and sleep evaluations, trying to weed those folks out that are showing signs of glaucoma that don't have high pressures and don't have other risk factors. And I do have a couple cases in my belt where I think that truly the glaucoma was halted and arrested with the use of a CPAP machine for sleep apnea. So
now, is there an age that's specifically more prone to glaucoma?
The older you are, the more prone you are to it, but don't think young people can't develop glaucoma, because they can. And they can have angle closure, they can have pigment dispersion, they can have myopic glaucoma, they can have primary open glaucoma, they can have inflammatory glaucoma. So don't think that young people can't develop glaucoma, because they can. But the older you are, the higher the risk for developing it is. But I have diagnosed plenty of younger people who you would thought never in their lifetime would they walk in the door and think they had glaucoma, and by the time they walked out, we had pretty much determined they had. Mm-hmm.
And again, the best way to learn that is by getting an appointment here at Central Kentucky Optometric Associates. They can take a look and examine any potentials there. And The best way to do that is make an appointment. So what's the phone numbers to call here in Lebanon?
In Lebanon, it's 270-692-1871, and in Springfield, it's 859-336-9388. And the computer system is combined, so you can really call either office and get an appointment at either office. The girls and the staff are able to do that for you. So, but remember that just getting your pressure checked isn't the only screening test for glaucoma, and it is kind of a silent disease, and one of the dangerous parts about it is going undetected.
Absolutely. Again, I've been talking with Dr. Trish Ciccone here at Central Kentucky Optometric Associates. It's been Gary White for Channel 6, Central Kentucky Television.